Thanks to everyone for joining us this afternoon to talk about this really important topic. I'm Dr. Roxana Gapster, President and CEO here at WellSpan, and I'm joined today by Dr. Tony Aquilina, our Executive Vice President and Chief Executive across the WellSpan system, and John Porter, our Chief Operating Officer. As an organization, WellSpan and others across the nation continue to care for our friends and neighbors affected by this deadly COVID-19 virus. I want to start by recognizing the dedication and commitment of our 20,000 healthcare heroes here at WellSpan. 9 months into the pandemic, I'm incredibly proud of the response and the work that they have all done. From the very beginning of the pandemic, our leaders, physicians, team members have brought their very best to WellSpan's mission every day, every patient, every time. They are the true healthcare heroes, the people who've given of themselves in order to care for the lives of their friends and neighbors. Let us not forget as we go about our daily lives that dedicated healthcare teams and support teams are continuing this fight against a virus which has claimed the lives of many across our service areas and in fact is currently affecting the lives of over 180 patients who are in WellSpan hospitals this morning fighting COVID-19. Today we're going to talk about ongoing measures to keep our communities, patients, and WellSpan team members safe, as well as our management of the ongoing pandemic and the questions that you all have posed to us. We still have a long road ahead of us, but I can assure you that there is a sense of urgency in our work these past few weeks, as we have seen an increasing number of cases across our geography. During our briefing today, we will touch on the current COVID-19 impact on our communities and hospitals, the regional data trends, including health equity, WellSpan's COVID-19 emergency response, and some plans that are taking shape around deployment of vaccines. Following our remarks, we'll host a Q&A. We have significantly increased the use of digital health and technology to help slow the spread of the virus, and we have continued those interventions during this time of resurgence, rather than requiring patients to travel to one of our healthcare facilities. This includes our 24/7 WellSpan online urgent care service, as well as our COVID-19 hotline. We have done over 400,000 remote visits with patients since the pandemic began. We're also using online apps and tools to help us manage COVID-19, including our coronavirus assessment tool that's online in both English and Spanish, as well as other innovative chatbots that we have as part of our My WellSpan portal. I would just mention that online scheduling of appointments, accessing of records, and connecting with care teams is all possible through our portal. And in fact, we were one of the first in the nation to use an Epic Care Companion tool to help us monitor COVID-19 patients who are recovering at home. We've also developed an online resource information center for patients, medical professionals, educators, and employers to help them understand what is best to do with the people in their lives and in their businesses. WellSpan believes strongly in caring for the whole person, including physical, mental, and emotional well-being, and we know that the pandemic is not just a physical health concern. It is causing significant stress and anxiety among our friends and neighbors. And so we've established behavioral health resources through our Phil Haven organization, both online and through a toll-free hotline to help community members take care of their mental and emotional needs. We're also proud to be collaborating with our community partners and care teams on the front lines, as we are part of a solution for both contact tracing, testing, and soon vaccine deployment. We're deeply grateful for the support of our community partners and for the incredible work of community leaders, local businesses, and elected officials in helping WellSpan respond to COVID-19. From the beginning of the pandemic, we wanted to ensure access to every person in our communities to receive the care that they needed. We knew that we had to remove any potential barriers and to make it as easy as possible for patients to be screened, tested, and treated. That's why in early March, we were one of the first health systems in the nation to announce that we would collect no out-of-pocket or co-insurance payments for either testing or treatment of COVID-19. Though it wasn't mandated, we knew it was the right thing to do. It was our mission in action. Since then, we have covered nearly $4 million in co-payments and co-insurance for our patients and their families. In addition to that, we've provided tablets similar to iPads for patients who are homeless and recovering in hotels and in emergency shelters. We've used our WellSpan online urgent care and and telehealth for behavioral health services to connect those patients to services that they need. I'm confident that our collective strength and the innovation that we're building on today will help get us through this resurgence of the pandemic, and it will serve WellSpan and our communities well. I'd now like to turn to Dr. Tony Aquilina, our Chief Physician Executive, to talk more about what we're seeing in trends and the steps we're taking to manage the pandemic.
Thank you, Roxana. First, let me say that I could not be more proud of our physicians, clinicians, nurses, and team members across the 6 counties of WellSpan Health. They've worked tirelessly and risen to the occasion in this pandemic, but unfortunately, the work continues. I'm going to share my screen and show you that nationally, we're seeing significant increases in COVID-19 cases. There have been record case counts multiple times over the last week. Over 1,000 people are dying every day. At the state level, we're seeing a similar increase with infection rates up 400% since August. That's 4 times as many cases in recent days compared to late summer. The trend across Pennsylvania follows the national trend with record case counts in recent days. Another way to compare, in April, Pennsylvania was seeing case counts around 1,800 per day, and over points of the summer had dropped to as low as 500 cases per day. In the last couple days, our case count has climbed to 4,000 in one day. Since the beginning of the pandemic, WellSpan has administered over 145,000 tests in our 6 counties. Regionally, we are seeing the highest number of patients since the start of the pandemic. Generally speaking, over the summer months, WellSpan hospitals had an average daily census of 50 to 60 COVID-19 patients, and that's among all our 6 acute care hospitals. You can see Lebanon is the yellow line, York, the light blue line, Franklin orange, Adams dark blue, Lancaster gray, all going up. Now recall that the hospitalization rates often lag the case counts by a couple weeks. In the past 2 to 4 weeks, we have seen an increase in WellSpan hospitals of 60 patients to 180 or so today. The concern right now within our health system is our predictive modeling shows that our counties may not yet be peaking from this most recent wave. In addition to the overall increase in cases, we have been intentional about reviewing data trends regionally to determine how we best support the needs of our communities. As happened at the beginning of the pandemic, we continue to see higher COVID-19 positivity rates for Hispanic and Latino community members at 19%. For Black community members, it's 13%. And in comparison, for white community members, it's 8%. This translates to more visits to the emergency department and urgent care. We recognize this disproportionate trend and made a number of impactful changes early in the pandemic. Number one, like translating our COVID-19 web pages, My WellSpan Patient Portal and resource guides to Spanish. Placing COVID-19 prevention digital signage in bodegas, churches, and businesses. And partnering with our local federally qualified health centers and community health coalitions to provide outreach, testing, education, and medical services. There's more work to be done, but we have been successful in closing some of the gap between our Black and brown patients and white patients. Looking at age, positive cases are more common among teens and young adults. While fewer children have been sick with COVID-19 compared to adults, they can be infected, can get sick, and can spread the virus. Cases and deaths are lower in children compared to adults. Around 9 to 11% of cases nationwide are in children, around 2% in children 0 to 4 years old, and there have been 109 deaths in children 17 and younger. That said, cases in children have increased nationwide by 15% in the last 2 weeks. Children who are under the age of 1 year, who have other medical conditions, are at risk of having more severe illness with COVID-19. Our physicians and advanced practice professionals are being mindful of the emotional and behavioral health needs of children during the pandemic, particularly with regard to disproportionate impact of COVID-19 on communities of color. We're following return to school guidance from schools and testing children when appropriate to allow schools to abide by the Pennsylvania Department of Health guidance. We do not have data yet on the virus's longer-term impacts upon children and families with regard to their physical, emotional, and mental health. As we move through the next few months, WellSpan leaders are monitoring important metrics on a daily basis. I also want to speak about vaccines. WellSpan Health is working collaboratively with the Pennsylvania Department of Health in preparation for a potential COVID-19 vaccine. We have a multidisciplinary team at WellSpan that meets regularly to plan storage needs, distribution, and other factors to be sure we are prepared to expedite the process and vaccinate our frontline healthcare heroes as soon as one becomes available. It is the opinion of many people working on these vaccines, including those part of the trials, that they will not be a magic bullet, at least not right away. They'll be similar to flu vaccine. Maybe 50%, 60%, 70% effective. Pfizer just announced yesterday their first look at their vaccine, maybe 90% effective, but we don't know yet. We did recently hear some promising news from Pfizer just this Monday, as I said, but we remain cautiously optimistic. We should temper our expectations for how well a vaccine will work and whether it will allow us to return to normal, whatever that means. It is possible a vaccine could assist in moving us toward a healthier future where we interact together, but it's important we have a realistic expectation of what a vaccine can do. I'd like to end with an important reminder about simple safety and healthy behaviors. In addition to the rise in COVID cases, it's also starting to be flu season. This combination creates renewed concern nationally about overwhelming hospitals. We need to do everything we can to encourage safe, healthy behavior. We need to be exhibiting some of the behaviors we were more accustomed to in the spring. To protect yourself, your family, and our communities, remember simple, effective steps to stay safe, particularly with the holidays just around the corner. Limit gathering sizes. Even small gatherings carry big risk. Avoid eating or drinking in groups. We know this is a high-risk activity. Follow masking and social distance guidelines and wash your hands and use hand sanitizer. Now I'm going to turn it over to John Porter, who will discuss our ongoing preparations for the COVID-19 cases in our community and our hospitals.
Thank you, Tony. My name is John Porter, and I'm the Chief Operating Officer for WellSpan Health. As Central Pennsylvania's trusted healthcare partner, we are taking bold, coordinated action to manage the number of patients requiring acute hospital care. Local incident command centers at hospitals are opened as needed to proactively manage issues with triggers in place to open regional and system incident commands. Currently, we have 5 incident command centers open right now: WellSpan Good Samaritan Hospital, WellSpan York Hospital, WellSpan Waynesboro Hospital, WellSpan Gettysburg Hospital, and WellSpan Chambersburg Hospital. It is important to note we continue to take a system-wide approach to managing this pandemic across all our care sites and our 8 WellSpan hospitals. Our hospitals will support one another, and we've structured our response in a way that we use the strength of the entire system. This support includes moving equipment and team members where they're needed most to ensure no hospital is overwhelmed. That work includes the WellSpan Patient Placement Center that we launched earlier this year. It's an operations center that logistically looks at each of our facilities from a capacity standpoint and determines the best locations for patients to receive their care. This includes non-COVID patients and making sure that they are medically stable and then they can be transferred back to their home hospital. We also have been able to use WellSpan Surgery and Rehabilitation Hospital for many non-COVID patients, which frees up space for additional COVID beds at WellSpan York Hospital. These are some examples of how we have faced capacity challenges from a system perspective. Keep in mind that we still do have the ability to double our intensive care unit beds at each one of our facilities to a total of 160 if and when that is needed. To appropriately staff those operations, some of our staff would have to be redeployed at that time. Regarding our medical supplies, we have implemented a multi-pronged approach in an effort to ensure our hospital care teams have the equipment and supplies they need. Our supply chain has done an incredible job securing PPE and other resources as needed. And now I'll turn it back to Roxana for a few final remarks.
Thank you, John. At WellSpan, we're doing exactly what our community expects of us during times of crisis. We're leading, and we're taking care of our neighbors. Please remain vigilant and renew focus on safety measures for yourself, your friends, and your family. Small efforts can go a long way to prevent the spread. One of the most important things for you to know, especially this time of year, is just what Tony mentioned, which is small gatherings can pose a significant risk. WellSpan will continue to be a loyal, trusted partner to our communities, working hard to deliver the safest, highest quality care. Now, Ryan Coyle from our communications team will help facilitate a brief question and answer.
All right, thank you all for speaking to that. I know that was a lot of information, and I do just want to remind, everybody hear me all right? Well, thanks everybody again for speaking to this. I do just want to remind you that if you are looking to ask a question, you can do that by jumping on to the Q&A at the bottom of the screen. So a couple of questions that I do want to pose. Let's see, the first one would go to Tony. This is from Shelley with the York Daily Record. Tony, Shelley says, Dr. Levine said in a news conference a couple weeks ago that healthcare officials have learned a lot through the pandemic, including better treatment methods than maybe what they knew at the start. Do you agree with that assessment? And if so, are you able to use those better treatment methods to shorten a patient's stay at WellSpan?
Yes, I agree with that assessment. Certainly, we are much more smart at treating patients, the sickest of those patients right now. That has not resulted in a shorter length of stay necessarily, because we are keeping people alive that may have passed away earlier before. But in general, our treatment strategies are much more effective now than they were when this virus first came and we knew nothing about it.
Gotcha. Okay, thank you. The next question also for Tony. This is from Ryan at CBS 21. He actually had asked if you can speak to the length of stay of patients, which you kind of touched on a little bit here, and how that has impacted capacity constraints, meaning are patients possibly just staying a shorter period of time and then getting discharged? What are you seeing?
So our length of stay for COVID-19 patients in our WellSpan hospitals remains between an average of 9 to 10 days. So they are staying here quite a while. Again, that has nothing to do with survival. We are seeing people survive. It does affect capacity, but we've been doing a great job managing that to this point. And as John said, our hospitals are managing to take care of these COVID-19 patients very well as taking care of the patients in our community who still need care, who don't have COVID-19.
Thank you. That actually transitions us well to John. John, this is a question from Jim Hale with the Gettysburg Times in Adams County. He's wondering if virus trends differ among the counties that WellSpan covers. Of course, we cover from Lebanon all the way to Franklin County and everywhere in between. And do the plans change to make access to testing more convenient? So just generally speaking about what each county is seeing across the board.
Sure. As Tony indicated on some of the graphs that he showed, we do have varied positive experience of the prevalence of disease in each one of our counties. A couple of weeks ago, we would have identified that Lebanon County and York County were seeing the most significant rise in the positive results of tests. Lancaster County soon joined, and now we see that Franklin and Adams County are catching up. So while there's been an overall rise in all counties, it has been varied, and there have been waves in each one, which are difficult to predict. Relative to testing, we are planning to move testing as quickly as we can to some of our physician offices across each one of our regions so that it's more available, and it can be done as we would do flu testing in each one of the offices. We are awaiting supplies and equipment to make that effective, and hopefully that they'll be in close to the end of the month.
Thank you. This next one also for you, John. This is from Vicki with the Franklin County Free Press. She was hoping that you could speak specifically to WellSpan Chambersburg Hospital and how they have managed capacity in recent days. If there's any numbers that you can share with how Chambersburg might be dealing with COVID-19.
Last week, I can tell you that Chambersburg Hospital had averaged about 25 COVID positive patients as inpatients each day. Today, that number is 50. So that shows how quickly the numbers changed and how much it has increased within a week period of time. We are managing today with the capacity at Chambersburg Hospital. We have had to increase our bed census with the amount of staff that we have to accommodate that and the other patients that we serve. And we're also working with Waynesboro Hospital, which is another hospital in our system, and they do have bed capacity and staffing, and we are transferring some patients to Waynesboro Hospital so that we're balancing that capacity challenge. That's the benefit of a system, and that is how we're trying to manage within each region. And if we then can't manage within the region, we're managing within other regions to help address the capacity issues that may arise.
Thank you, John.
I would say the numbers are comparable within each one of the regions. York Hospital has 56 inpatients today. Good Sam Hospital has 38 inpatients today. So I think you can see that Chambersburg Hospital is high, but similar to what we're experiencing in the three other regions.
Thank you, John. You do make a good point. And I will mention also to our media partners that keep in mind we have hospitals from Lebanon all the way to Franklin County. So Good Samaritan Hospital in Lebanon, WellSpan Ephrata Community Hospital in Lancaster counties. You're, of course, familiar with WellSpan York Hospital, WellSpan Gettysburg Hospital, and then two more in Franklin County as far as our acute care hospitals are concerned. So really relying on that system approach. The next question, and this is kind of like a good opportunity for Tony to speak to a question from Logan with the York Dispatch. He had questions about the modeling that WellSpan uses and when we might expect to see a fall resurgence peak and how we kind of utilize some of that modeling.
We use several models and try to come up with a best guess, and some of the models have been off. Some have been a little more accurate. I think we expect this current surge to continue. Some of the models show it receding and then over the holiday season and then coming back up post-holiday season to yet another surge. That, of course, having a surge in January and February is concerning because that coincides with peak flu season. So that's really what we're trying to look forward to understand how we would manage if those models are correct. But we don't just use one model. There are several models out there, and we look at and make our own best guess from those models. None of the models can perfectly predict human behavior, and so much of this is driven by human behavior, particularly with regard to masking, as we said.
Thank you. Okay, another question from Shelley with the York Daily Record. She's asking, are the patients you're treating today, this would be for Tony, I believe, are the patients you're treating today similar as far as their condition as patients you treated at the beginning of the pandemic? Are they in better shape? Are they in worse shape? And if there is any difference, what do you attribute that to? Age.
There is a difference because more of the younger people are getting infected now. The average age of our patient has gone down. And as we know from this virus affects younger people less severely on average. But that's not to say we don't have some very sick people who are younger than Medicare age and in our hospitals yet. So it's something to be concerned about for everybody. But we're seeing the sickest people are still generally the people who are older or who have comorbid conditions. Thank you. The next question is from Samantha with Fox 43. This question is for John. John, the question is, what specifically have you noticed has changed as far as operations between March and now with regard to the hospital's response to the virus? And what are some of the concerns that maybe we had back then versus what we have now as far as how we're going to handle our response?
Well, in spring, we closed most of our outpatient facilities as well as our elective procedures at all of our hospitals. And that was in compliance with what the State Department of Health had asked us and what we expected in the pandemic. What we see today, luckily, we did not have to close all of those down at the current time. We're able to treat the number of COVID patients we have within the capacity in the system, and we have not had to close our ancillary facilities and our elective procedures at this point. That requires a balance, and we have established triggers so that if we get past certain points, we will start to redeploy staff to ensure that we're taking care of our sickest patients in the hospital and have to redeploy them from other settings to allow that to occur. So the biggest difference today is that we are treating COVID on a constant basis and understanding the waves that are coming with increases and decreases and trying to balance that with providing services that we need to provide for patients that have waited for procedures and other things since the spring.
Thank you, John. Okay, the next question would be from Shelley at the York Daily Record. This question relates to, this would be for Roxana. Roxana, if you could speak to this as far as what has the pandemic taught WellSpan, either as a facility or in reference to medicine as a whole? And are there things that you had to turn out of necessity, such as telemedicine she references, that may be sticking around going forward, even once we're past the pandemic? And what are some of the concerns you have moving forward?
Yeah, I think we've learned a multitude of things through the pandemic. We've certainly learned to treat patients better. Tony mentioned that. We've learned to leverage our system. John mentioned that, working together across our system. We've also learned that just-in-time supply chain is probably something that we need to rethink for the future, and that we need to have both supply chain capacity in our local areas as well as having perhaps some global supply chain initiatives. Telehealth and digital health have been a huge win for both WellSpan and I think nationally. We would not have been able to provide care to some of our vulnerable patients without the use of digital health and telemedicine. Having the ability for patients to go online and perform assessments before they walked into the office initially during the pandemic was very helpful to us. It helped us prevent spread back then, and it is something that we may need to reconsider now as we move forward with some of our workflow processes. So I think that there's been a number of really great learnings. What I'm concerned about going forward is just what Tony mentioned earlier, that we do have the flu season and COVID-19 colliding now over the next few months. And whether or not all of our health systems in our region will have the capacity to deal with both, I think is a question.
Okay, thank you. And we are just at about time here. It is 12:45. I do just want to remind everybody that once we are complete here, we will be uploading this video as well as a news release to our website. So if there are any questions, any documents you were looking for, this will be uploaded in full here to wellspan.org within the coming hours later on this afternoon. So I want to thank Roxana, John, and Tony for providing us some insight into how WellSpan is managing this. I know it's been a long 8 or 9 months now, and I know there are still several months to go, but I also appreciate everybody from the media helping to tell the story as to what we can all do here to keep everybody safe as we head through the holiday season. So thanks again for joining us, everybody. If you have any follow-up questions, please feel free to reach out to me. Thanks, and have a great day.